Today, we are joined by nurses from National Nurses United, the largest professional association of registered nurses with 185,000 members. We are here to talk about the health impacts that the Keystone XL pipeline and its tar sands oil would have on our nation. They will also tell us about their plans for action on this issue, and I am very excited about their action plan. You know, when you ask the American people which professionals they trust the most, they put nurses at the top of the list. A recent Gallup poll found 82% of the public say nurses have high or very high honesty and ethical standards. It was the 12th year in a row that the public rated nurses as the most trusted professionals. And in the interest of full disclosure, members of Congress came in at 8%. So I'm very hopeful, but just standing here with these fabulous people, I'll just get a little bit of the rub off from that. Now, 2 weeks ago, right here in this room, I held a press conference with doctors and community representatives from Canada and the United States. And they told us how their communities have been or would be harmed along each step of the toxic tar sands oil process, from the extraction to the transport to the refining to the waste disposal. These health professionals connected the dots between tar sands and health miseries along the pipeline's path, from Alberta, Canada, through communities in America's heartland, right down to the Gulf Coast. The Keystone XL pipeline would transport tar sands oil, which is one of the filthiest kinds of oil on the planet, through communities in environmentally sensitive areas in 6 states to refineries along the Gulf Coast. Today, we will hear from nurses from some of those affected states. One of the states the Keystone XL pipeline will travel through is Kansas, and we will hear from a nurse from that state. Another nurse with us today is from Chicago, where open piles of the tar sands waste product, known as pet coke, that's short for petroleum coke, have exposed her community to blowing clouds of black dust. This type of soot pollution, which contains concentrated heavy metals, can increase and does increase the number and severity of asthma attacks, or they could cause or aggravate bronchitis, and they can contribute to other lung diseases. Nurses from Houston and my great state of California will also tell us about their health concerns posed by the tar sands refineries. In January, the State Department issued the Keystone XL Pipeline's Environmental Impact Statement, the EIS. It was woefully inadequate when it came to exploring the human health impacts. And that is why Senator Whitehouse and I wrote to Secretary Kerry 2 weeks ago asking for a comprehensive human health impact analysis of the XL pipeline. We want a separate analysis of its impact on human health. Since that time, the State Department has received over 2 million comments from the public opposing the pipeline. I want to make it clear again that we need a comprehensive health analysis on this project. Anything less than that is unacceptable. I so appreciate nurses being here today to underscore the importance of health impacts of the pipeline. Again, I am pleased that they are here, and I am even more excited that they are calling on the State Department to address the failure to fully consider the health impacts of the pipeline. So we have this incredible group of nurses underscoring the need for a health impact analysis. They are the ones that will deal with the sick and the hurt. You will hear more about that from the co-president of National Nurses United. The permitting decision will be based on whether the Keystone XL pipeline is in the national interest. And I believe very strongly, and I think I speak for the nurses as well, and certainly for Senator Whitehouse and myself, that exposing more Americans to pollutants that are clearly linked to cancer, let me say that again, exposing more Americans to pollutants that are linked to cancer and respiratory illness is not in the national interest of the United States of America. So don't just take my word on it or that of the peer-reviewed science on the issue. take the word of America's most trusted professionals, the nurses. So with that, I'm going to turn the podium over to Karen Higgins. I'm going to tell you a little bit about her. She's a registered nurse from Boston. She's co-president of National Nurses United. She will discuss her organization's efforts to raise awareness about health concerns associated with the Keystone XL pipeline and with the tar sands oil. Karen Higgins. Karen, do you want this or should? Yeah.
No, I can use it.
Yeah, you should use it, and then we'll take it.
Oh, it makes me feel tall.
I know, because you are.
Good morning, everyone. I first would like to thank Senator Boxer for hosting this event today and inviting our organization to participate. I would also like to welcome all the nurses in the room who have taken out the time today from across this country to be here to share how important this is to all of us. As you know, we are here today to endorse a call by Senator Boxer and Senator Whitehouse to the State Department and the Obama administration to conduct an immediate, comprehensive study of the impact of the proposed Keystone XL pipeline on the health of American families and workers. NNU believes that a project that places the health and safety of our patients, our families, and our communities at a substantial risk cannot possibly be in our nation's best interest. A comprehensive analysis is essential. It's critical that the State Department's environmental impact study was inadequate in assessing the human health consequences of the Keystone pipeline and the significant expansion of tar sand oil production, transport, and refining. In addition to sending a letter to Senator Kerry today, we are also asking other organizations and individuals to join us to call for this to happen. You can see the petition on nationalnursesunited.org, and we will present these petitions to the Secretary as well. In early 2013, NNU announced its opposition to the Keystone. We said that we were concerned about the health hazards associated with the production, the transportation, and the refining of crude, dirty tar sand oils that were beginning to emerge. And since then, we've heard even more health impacts coming out. Tar sand mining pollutants have linked to cancer, to leukemia, to genetic damage, and birth defects. Major tar sand pipeline spills in Michigan and Arkansas have beset local residents with cardiovascular, gastrointestinal, neurological, and respiratory impacts, as well as persistent coughs, headaches, nausea, eye, and skin problems. The tar sand refineries have been linked to ailments of the nervous and respiratory systems. Dust storms in Chicago and Detroit off the piles of Petco, the byproduct of tar sand refineries, has coated homes and areas where children play and raises concerns about heart attacks, decreased lung function, asthma, which we already know is at epidemic levels in this country, and premature deaths. It is for our patients, our members, our families, and our communities that we speak out and call for the administration to order an immediate health impact study and not authorize a pipeline that will harm our planet and the health of the people of this country. So I thank you for this opportunity to speak on this, because we are really extremely concerned of the effects of this pipeline on the people in this country. So thank you.
Karen, thank you so much. And I just want to say how excited I am that you're doing an online petition. And where do people go to find that again?
It's at nationalnursesunited.org.
nationalnursesunited.org. This is very important that we wake up this country to the impacts that could affect their families. And now it's my privilege to call up Kerry Columbus, RN, Kansas City, Kansas. She's a registered nurse there, and Kansas is one of the states in the pipeline's path. She will discuss concerns about the pipeline and health issues in her family that could be aggravated by tar sands pollution. And I'll push this away, Kerry. We have Karen and now Kerry.
Hi, good morning, everyone. Thanks again for your time. As a registered nurse in Kansas, I'm an
Go ahead.
Oh, okay, sorry, I'll start over. As a registered nurse in Kansas, I'm in opposition of the Keystone Project. I daily see the effects of pollution on the health of everyone, including myself, my children, and patients that I take care of daily. It is proven that the effects of pollution currently affect a majority of the U.S. population, more than 40% to be exact. I myself have asthma, one of my daughters has asthma, and I see many patients that also deal with respiratory illnesses that could be made worse by this impending project. being on the path of the pipeline, I'm concerned for our health and safety as that a rupture could cause. Already there's been determined and detrimental effects as a rupture in Arkansas happened last spring. And this has proven that residents were unable to return to their community, and they also deal with the lingering respiratory and other ailments for months and possibly irreversible damage for years that can cause chronic illness. We have seen what can happen with tar sands pollution, and we believe that's an experience that we don't need in my state or any other state, or for any other families to have to experience. We need to look at the long-term consequences of our actions as a whole. Instead, we seem to be more focused on money than the people affected by the choices that are made for them that they are not in control of. Someday it won't matter when we have caused so much damage to the earth and its inhabitants where there's no way to reverse or compensate for it. If you think healthcare costs are up and healthcare is an issue now, it can only get worse from here. So, thank you.
Thank you so much. And now I want to call up Rolanda Watson, RN, Chicago. She's a registered nurse. She will tell us about one neighborhood that was evacuated in December 2013 because of those pet coke deposits. And again, pet coke is short for petroleum coke, and that is what gets stored after this tar sands is put into the pipeline.
Good morning, I'm Rolanda Watson. And one day at our clinic in December, we were evacuated because of this cloud of pet coke. I live in Chicago, which is called the Windy City. So as you know, we're gonna have lots of wind. These plumes of pet coke are not covered, they are not contained. And so you're constantly getting these clouds blowing everywhere. They're covering houses, picnic areas. Children can't play outside. They can't eat their food outside because these particulates are going to be embedded in their food. And when inhaled, they're embedded in your lungs. And as you know, asthma, as she said before, is on the rise. And in our clinic, we saw more respiratory-related illnesses, asthma. These particulates aggravate and can cause bronchitis. They can cause lung diseases. And these diseases, lung diseases, will significantly decrease your chance to fight other infections. So in the long run, what you're going to see is more hospitalizations, more health care costs are going to go up. There are going to be more claims to Medicare. So in this, knowing these things and knowing that these particulates are toxic and they're laced with vanadium, along with other concentrated metals such as mercury, lead, arsenic, chromium, and nickel, I urge, as well as we all urge, for stricter regulations, stricter fines for these companies that are not doing what they're supposed to do to cover up this pet coke, petroleum coke. If you ever go on to the website petcoke.org, you can see these mounds of this black toxic material that are going to be embedded in people's lungs. I also, at this point, want to thank you for having us here and strongly support a call for a full health impact study by the State Department prior to taking action on the Keystone pipeline.
Thank you. I thought I'd show you a picture of these mounds of pet coke. So, Joe, could you? I don't need that. It's okay. This is what it looks like, and it's after it's refined. So at the place of the refinery, then these mounds are just like mountains of waste. And as it was pointed out, they do blow around. And we had a physician tell us last week that what happens is that, I think it was in Chicago, where kids had to leave a picnic because this pet coke was blowing all around and they were filthy and covered in this soot. It's a nightmare, you know? And again, what is your definition of national interest? Is it in the national interest to keep our people healthy? Yes. And that's why we're here. So now we're going to turn it over to Brenda Pruitt. She's a registered nurse from Houston, Texas, and she's going to talk about health concerns related to tar sands pollution from refineries in her area.
I am a nurse in Houston, have been for a while. I originally came from the north, so I can attest as well. I never had asthma or respiratory issues until I came to Houston. You know, Houston and the surrounding areas of Port Arthur, Texas City already have oil refineries in place. So to bring this would just increase. There are many reasons out there as why we should oppose the expansion of the Keystone Pipeline through America. There are multiple reports out there regarding this that you can go online and find. I currently, as I said, live in the Houston, Texas area, and I'm a pediatric nurse, and would like to address some of the issues that are in regards to our children. You know, remember, our children are our future, so we have to think about that. The pipeline threatens many of our aquifers in Texas, which would mean that it could leak into the water system, and that's our drinking water. So not only might we breathe it, but we're also going to drink it. So there's going to be increase in lots of things. TransCanada has already indicated that up to 700,000 gallons of Sands crude oil could leak into the pipeline without triggering their real-time leak detection system. This alone could cause an increase in cancers in children as well as adults, since it has been those tar sands are thinned with chemicals that cause cancer. A Rice University study showed that levels of cancer-causing chemicals produced by the oil refining are already, in some cases, 20 times higher in Houston than in other cities, and this is before the pipeline is coming through. Children living within 2 miles of the Houston Ship Channel, which is where the pipeline would come in, are 56% more likely to get leukemia than those living 10 or more miles away. That's a really big increase, and we already have an increase, like I said, over more cities because we already have oil refineries. Then you have the toxins that are in the air. They're going to increase from the refining of this oil. The tar sands oil is dirtier than refining conventional oil, and results are higher emissions of toxic sulfur dioxide, nitrous oxide, and these cause smog and acid rain and contribute to the respiratory diseases like asthma, chronic bronchitis, and lung cancer. According to the EPA, short-term exposure to elevated levels of sulfur dioxide is associated with reduced functioning of the lungs, chest tightness, wheezing, shortness of breath, respiratory illness, and also aggravation of the cardiovascular system, which is your heart. You got to have your heart in order to function. So when you start dealing with all those things, your health concerns and your health abilities are significantly lower. We already see some of the respiratory issues in Houston and in Port Arthur areas due to oil refineries. The Pipeline Hazardous Materials Safety Administration states that the pipeline regulations currently do not and are not designed for the tar sands crude, and they have not yet evaluated what measures are needed, nor have been involved in the environmental reviews in order to make this more safe, which is a really big concern. In conclusion, the tar sands is one of the dirtiest fuels. It's more costly to refine, not only costly by money, but it's also, in the end, it will cost us the health of our children, the health of ourselves, and areas near the pipeline, it will cause problems with the health of our land, which we need our land in order to live, because that's where we grow the foods that we need. Facilitating this pipeline will delay funds and investments into things that could be better for our environment, like plug-in cars, alternatives to transportation, and things that help us with those kinds of things. All of us want to protect our future, and our children are our future. I see that increase in all those diseases as the children come through my hospital ward. And when I worked at UTMB in Galveston, where there was a big children's facility, I saw it there. I see it in the health of myself and the health of other adults with respiratory issues and heart issues that are increasing drastically in the Houston and Port Arthur areas. So I stand with NNU and say, we need to stop the Keystone Pipeline. It's not worth the health of our future, which is our children, or the health of our land. Thank you so much.
Thank you so much. And before I call on our last but not least nurse, I want to show you a picture of what happens at these refineries. This is Port Arthur. Look at this. You couldn't tell the story better. Here are the play yard, and look at what's happening there. And then once they refine it, you've got the pet coke, and that'll have to be stored there. So I would say to my Houston nurse, you have every right to be disturbed, upset, and it's not in the national interest to do this to our children. You're so right. And no one has paid attention to this enough. And that's why I have taken up this issue. And after this press conference in another about hour. We're going to have a hearing about the Keystone Pipeline in the Foreign Relations Committee, and I'm going to bring this up as an issue that must be looked at. And I'm going to tell everybody about this press conference and your remarks. All of you have been so amazing. So now we're going to hear from Katie Romer. Is it Raymer or Romer? Romer. She's a registered nurse from Oakland, California, who will tell us about tar sands pollution from major refineries in nearby Richmond, because we are refining some tar sands there, as well as other general health concerns she believes are related to the Keystone XL pipeline. So, Katie, welcome.
Hi. So first I just want to say thank you to Senator Boxer. She represents me and the great state of California, and thanks for standing up against the XL pipeline and for organizing this press conference. My name is Katie Romer, and I'm a registered nurse, and I'm a member of the National Nurses United. Nurses oppose the construction of the XL pipeline because the health risks posed by the pipeline put our communities and our patients at risk. I live in Northern California, and while I'm grateful that the proposed pipeline does not come through our area, the tar sands oil is already being transported by train into Northern California to refineries in Richmond, California, which is a few miles from where I live. 25,000 people live within 3 miles of the refinery in Richmond, and 85% of them live below the poverty line, and as well are people of color. These people had no voice in the decision to import and burn this toxic oil. In order to transport it, the tar sands must be diluted with a toxic mix of chemicals that include benzene, toluene, lead, and chromium. The tar sands industry won't reveal the exact chemical mix used, so when it spills, it's a lot more difficult to clean up because you don't know what the mix of chemicals is that you're trying to clean up. These chemicals pose serious health risks to humans, such as respiratory toxicity, cancer, and nervous system damage. In addition, they are more corrosive than regular crude oil, so this makes spills more likely and more toxic when they occur. Currently, the people who live near the Richmond refinery suffer from higher rates of asthma, chronic breathing conditions, and cancers. Importing and refining the heavier crude oils like tar sands oil will lead to more particulate and sulfur emissions and other pollution put into the air as well, further exposing these residents to risk. We are already seeing the effects of climate change in more extreme weather patterns, drought, severe winter storms, and hurricanes that cause incredible human suffering and death. We can and must do better for the well-being of our planet and the health of all who live here. We must understand the health impact of the extraction, transport, and burning of the dirty tar sands oil to make an informed decision. That's why we're here today as nurses with a message for the State Department and Secretary Kerry. Do not approve the Keystone pipeline unless you can certify that it will not harm our patients, our families, our communities, and our nation. Thank you.
Well, you've just heard from the most popular people in the country. And, you know, politicians say a lot, and sometimes people hear us, and a lot of times they don't hear us. People need to hear these voices. These are the people who take care of our families. These are the people that see the results of mistaken policies. And I'm so grateful to them. I mean, they've got a lot on their plate. And the fact that they would be here and join us, we're asking for something quite simple. We want a comprehensive health impact study on what will happen when this pipeline is built. We need that study. We need a study on tar sands, what toxins are in there, what are the effect of those toxins, and how will all this fresh new tar sands oil being extracted impact the health and safety of our people. Look, I know this is an uphill battle, but I've had those before. Every one of my elections has been an uphill battle. And one of the reasons I stand here is these folks were the first ones to say, "Go, Barbara." So what we're saying here is we want to be listened to. We want a health impact study. That is in the national interest to perform that health impact study. because it doesn't do us any good. And by the way, most of this oil will be exported, let's be very clear. It doesn't do our economy any good. And all this about jobs, it's like 50 permanent jobs. Let's face facts. Yes, there will be a couple of thousand building the pipeline, but permanent jobs are about 50. And I think if you asked any American, is it worth it to do this if your child, and I haven't seen that particular study on leukemia, but if it's true that the leukemia rates would go up exponentially, is that really worth it? I think they'd say, you know what, we don't think so. So I really appreciate the nurses being here.